You've probably heard someone say, I have fibroids. A sister, a colleague, your mother, or maybe even you yourself. It's said almost casually, like it's just a fact of life for Nigerian women. And statistically, it almost is. Welcome to another episode of Doc Series. I'm Dr. Mabel, and today we'll be discussing uterine fibroids, what they are, where they come from, the symptoms, and how we can manage them. Uterine fibroids, also known as leiomyomas or myomas, are non-cancerous growths that grow within the uterine wall. Now, what do I mean by non-cancerous? This means that fibroids do not form cancer. They are benign. They're very enormously in size, some as small as a seed and some as big as a grapefruit. In Nigeria, we have documented cases of fibroids as big as 11 kilograms at the time of surgery. This is due to something which I will talk about later, called late presentation. Globally, fibroids affect between 20 to 80% of women by the age 50. A very wide range, yes, but this is because detection depends heavily on how you look for them. Many women have fibroids and they never know it. But for women of African descent, the burden is significantly higher. Studies estimate that up to 70 to 80% of African women will experience fibroids within their lifetime. A 2-year review at a Nigerian tertiary hospital found that nearly 1 in 3 gynecology patients had fibroids. In Ghana, one hospital found fibroids in 79% of uterine tissue examined histologically. What's most striking in African women is the age of onset. A Nigerian study in Newi found a mean age of 35.7 years old for the presentation of fibroids in African, or rather Nigerian women. These are women in their prime reproductive years. In Ghana, the highest fibroid incidence was in women aged 35 to 39. And globally, black men develop fibroids about 5 years earlier than white women, with their sizes bigger and more severe symptoms on average. When people talk about fibroids as though they're an older woman's problem, they're not, at least not for us. So, why do fibroids form? We don't have a clean answer for why fibroids develop. What we have is a cluster of factors that increase risk. Let's get to them. 1. Hormones. Fibroids are estrogen and progesterone dependent. They grow during reproductive years when these hormones are at peak, and they almost disappear completely at menopause. This is why fibroids are not a concern before puberty and rarely a problem after menopause has occurred. 2. Genetics. If your mother or sister had fibroids, your risk is significantly higher. A family history triples your risk in some studies. This partly explains why fibroids occur in clusters and in communities. 3. Race and ethnicity. This is not fully explained by genetics alone. There are biological, hormonal, and environmental factors that combine to make the African woman more susceptible to fibroids than the white woman. There are also differences in how fibroids respond to estrogen receptors in women. 4. Obesity. Excess body fat leads to higher estrogen levels, since fatty tissue produces estrogen. This creates an environment where fibroids thrive. Note that this is not a moral judgment, it's a hormonal mechanism. 5. Diets. Diets rich in green vegetables and high in red meat have been associated with a higher fibroid risk in several studies. A diet rich in fruits and vegetables appears to have a modest perspective on the protection from fibroids. 6. Menarche. This means girls who start their period early have a longer exposure to estrogen than others. What does not cause fibroids? Sex, stress alone, something you did, or eating particular foods. I want to name that because the misinformation around fibroids in our communities is significant, and shame around supposed causes delay women from seeking care. Now, for classifications of fibroids. Fibroids are classified by where they sit in relation to the uterus. Intramural fibroids grow within the muscular wall of the uterus. These are the most common type. They can cause the uterus to feel enlarged. Submucosal fibroids grow within the inner lining of the uterus on the endometrium. Even when they are small, they tend to cause significant bleeding and pain and cramping, and they are most likely to affect fertility. Subserosal fibroids grow on the outer surface of the uterus, sometimes extending outward like a lump. This often causes pressure symptoms such as back pain, urinary frequency, that feeling of fullness in your lower abdomen. Some fibroids are pedunculated. That means they hang off the uterus on a stalk. They can be internal or external and cause varying kinds of symptoms. One uterus can carry multiple fibroids of different types at the same time. How are fibroids diagnosed? Many fibroids are diagnosed by accident, during a pelvic exam, during pregnancy scans, or something else entirely. This is because a large proportion of women with fibroids have no symptoms at all. When symptoms do prompt investigation, the primary tool is ultrasound. Usually abdominal ultrasound, sometimes a transvaginal ultrasound to confirm the presence of fibroids, map their number, the sizes, locations, and monitor them over time. It's accessible, affordable, and related to other imaging. It's available across most Nigerian cities and towns. For more complex cases, like when surgery is being planned, when the fibroid burden is large, or when the exact relationship between the fibroids and the uterine cavity needs to be discussed, an MRI, which is a magnetic resonance imaging, gives a far better picture. It shows the precise location, the precise size, and can also help distinguish fibroids from other conditions. The point is, if you suspect something is wrong, imaging is where you start. And if your scan is fine, and your symptoms are not, push for more. The problem of late diagnosis and presentation. In Nigeria, a research from the University College Hospital of Ibadan found that many women have symptomatic fibroids and wait years before seeking medical attention. One studied an average symptom presentation of over 38 months before patients come in, more than 3 years of living with symptoms before a woman comes in for consultation. By that point, fibroids are often large, complicated by other symptoms such as anemia, weakness, and many more, which I'll discuss later. They may require more aggressive intervention and would have been better noticed earlier. Why does this happen? Mostly because of fear. Fear of surgery. Many women associate fibroid with diagnosis or with hysterectomy, which is the removal of the womb, or they worry that they will never have children. Another reason is also financial constraints, which play a role. So does the normalization of heavy, painful periods as something women are supposed to endure. And in some cases, women turn to herbal remedies or to unusual interventions before presenting in the hospital. None of this is unique to Nigeria, but the consequences are particularly pronounced in settings where access to full range of Medicare and management options is usually limited. Knowledge is the first intervention. Understanding what fibroids are, what the options are, and that the treatment does not automatically mean a removal of your womb. This goes a long way and changes the conversation, which is exactly why we're here. If you found this video helpful, share it with a friend, share it with someone who needs it. That's literally how awareness works. Throughout the month of July, we'll be offering a 15% discount on pelvic scans and transvaginal scans here at Chem Health Diagnostic Center. Come get checked today.